Coming up next on Insights on PBS Hawaii, what are the mental health challenges for Native Hawaiians? Aloha and welcome to Insights on PBS Hawaii. I'm Dan Boylan. Studies show that Native Hawaiians have higher hospitalization rates than any other Pacific Islander group for depression, bipolar disorder, and anxiety disorder. And Native Hawaiian teenagers are more at risk for attempting suicide than their peers. These statistics shine a light on Hawaii's need to provide better access to mental health services. How can we help Native Hawaiians get the mental health care they need? What more can we do? We invite you to join our conversation by calling, emailing, or tweeting your questions and comments. Now to our panel. Vicky Holt Takamine is a kumuhula and Executive Director of the Pa'i Foundation, a nonprofit organization whose mission is to preserve and perpetuate Hawaiian cultural traditions for future generations. Poka Laenui is the Executive Director of Hale Na'au Pono, a community-based behavioral health center in his Waianae community. Dr. Nalani Blaisdell-Brennan is a psychiatrist who works in private practice and at the Waianae Coast Comprehensive Health Center. She has studied the role of culture on mental health. Christen Marquez is a filmmaker who made her directorial debut, with the documentary E Haku Inoa, To Weave a Name. Christen's documentary focuses on her relationship with her mother, a Native Hawaiian cultural practitioner diagnosed with schizophrenia. I'm going to start with you, Poka. You haven't been here in a long time, so you get it. What are the mental health challenges for Native Hawaiians in your mind?
I think it goes deeper than just the mental health practice. I think the society has developed over a period of time, especially after the overthrow of the Hawaiian nation, so that we have, over a period of time, developed a deep culture that functions within Hawaii, whether it's in the health system, the economic system, the education system, the political system, the environmental system. And it's based on three fundamental pillars: the pillar of domination, the pillar of individualism, and the pillar of exclusion. It's what I call the DIE, deep culture. And that deep culture simply is not appropriate for well-being, not only for the Native Hawaiians, but for people of many different ethnicities. On the other hand, you have another culture that you find in the communities. It doesn't control the formal system, but it's in the informal system. And instead of domination, it's what we call olu-olu. It's to be sort of kinder, gentler, not always dominating and saying, I'm better than you, or things like that. Instead of individualism, it's lokahi, to think of the general community, the family, the larger community. And instead of exclusion, it's always aloha, to be inclusive with a sense of humanity. That is a culture that brings about health. It's the ola culture, olu-olu, lokahi, and aloha, as opposed to the domination, individualism, and exclusion culture. And it's not only for Native Hawaiians. Until we make that broad shift of a cultural change, and within that cultural change, you change the way we do mental health, the way we do economics, the way we do all of these other things, only then are we going to start getting a healthier community. Taken from a lot of Native Hawaiian principles, but really it stretches throughout our communities.
Vicky, do you feel that the Hawaiian community and the young people that you're teaching at Leeward Community College, for example, young Hawaiians, do you feel that they are becoming more culturally sensitive themselves to the roots of their culture?
I think that's the direction that we want our community to go, but I don't think that everybody is in there. So definitely the students that I reach out to that come to Leeward Community College, that come to the University of Hawaii, are exceptional. They are accessing resources. So they're seeking out education. It's the ones that are not in that system that we're concerned about. It's the ones that are not going to college, that are not having access to resources to allow them, or even the home environment that provides them that support system. If you're living out in Waianae, it takes you 2 hours to get back and forth. 4 hours out of the day before you get back to your family. So if you're leaving here at 6 p.m. at night, you're not getting home till 8 o'clock, and you don't see your children till 8. They don't start dinner till 8, or somebody else or one of the kids is cooking dinner for them. So we're looking at remote rural communities where we were designated, through the Admissions Act, to these rural, remote areas without any resources out in that community. And it is only through the Wai'anae Comprehensive Health Center and, Auntie Aggie and Kamaki, who insisted on building a center for our health community to serve the needs of the Wai'anae community, that we're able to have some resources. Otherwise, where would the next ambulance come from? Town, and how long would it take to get there? We lose so many Hawaiians that were at risk of being lost because of the distance. And those are the homestead communities that are in the remote areas of all of our islands.
Nalani, you're treating people people are having mental health problems on the Waianae Coast. What are the biggest challenges that they face in your mind? Is it distance, or is it it's more than distance, right? There are this problem that Poka has been talking about.
Well, as you know, I'm my father's daughter, and my father sees each person as an individual.
We should say Kakuni Blaisdell's daughter, the founder of the University of Hawaii Medical School.
Yes. My father doesn't see an individual as sick or well, or Native Hawaiian or not Native Hawaiian. He doesn't treat people because they're Native Hawaiian. He sees people because he's Hawaiian. So the Olu Olu comes because he's Olu Olu. So you're asking me, how does he treat people who come in with illness? He doesn't see them as ill. He treats them, and he's taught me to treat them, with the spirit of Olu Olu, with kindness and with justice and with malama. So I'm not sure what your question is. You're asking me, how has my father taught me to see a person? My father's taught me to not see a person as schizophrenic, but to see a person as, who's your mother? Who's your father? Mm-hmm. What family do you come from? How was your day today? Was it hot when you walked in? And how are you feeling now?
Let's tie it to Poka's point. What role does culture play in your mind in mental illness?
So the way my father taught me, I don't look at someone as a 45-year-old Native Hawaiian person with schizophrenia. I look at someone who has come in and is asking me and is telling me that they're hurt. And that's the way my father taught me. Okay? Now, I'll tell you a story. One day a man came in and he said he was hearing voices and that his family was shaming him because he was hearing Hawaiian voices. So I listened and listened, and it turned out the voices were speaking to him in Hawaiian. And his father and brother were telling him, "Shut up, stupid, there's nobody talking to you." Well, I listened and listened, and I asked him, who were those voices? His kupuna kane. Long story short, did I give him Risperdal? No. Did I call him schizophrenic? No. According to the DSM-5, and I'm board certified in the American Board of Psychiatry and Neurology, schizophrenia is only defined if it's impairing and if it's not according to cultural practices. He was hearing the voice of his kupuna kane, who spoke only to him because he was raised by his kupuna kane, and his kupuna kane was not talking to his father and to his brothers because he was not chosen by them. So the answer to your question is, when I see someone, I don't treat them, I listen to them. And if they don't need medication, I don't provide medication. So I don't see myself as a treater. I see myself, as my father taught me, as my father always taught me, the patient comes first and doctor means teacher. So I try to do more listening than treating.
Vicky, you were going to add something?
Yeah, I think that your story brings up a real important issue, is the fact that many of our Hawaiians, our culture has been stolen away from them. So hula was banned, Hawaiian language was banned. All of these things that were important to our cultural and to our livelihood was banned from public in schools. My grandmother, my grandparents were one of 10 children. They had 10 children. They both spoke fluent Hawaiian. My grandmother was fluent Ika Olelo Hawai'i. Not one of the 10 children speak any language. I'm the firstborn of the next generation. My grandmother, I tried to learn Hawaiian from my grandmother, and she was like, wouldn't teach me any Hawaiian language. So I came to the University of Hawaii and took my first language class in Hawaiian language from Lordi Kaulili. We didn't have diacriticals. We didn't have any of those okina or kahako. We were not looking at kapepe or all these different kinds of language techniques that they're teaching now. We just spoke and read Hawaiian language. But Grandma told me it was book language, that wasn't Hawaiian language. She still refused to talk to me. So of my generation, I was the only one. And I'm looking back at that tells me a lot about what has happened to our people. They're not connected to their Hawaiian culture at the root of it. We all have to come back. So in the 70s, when we graduated, all of us we come from that generation of the 1970s, where we looking for reestablishing Hawaiian language schools for our Punanaleo, Navahi, to teach the next generation.
But, and now it should be noted, the Hawaiian charter schools are going a long way in that direction, are they not?
Well, and they're graduating and they're surviving regardless of No Child Left Behind. They're having successes. Their students are going to college. They're bilingual. And so, the story goes on. I have now 3 grandchildren. 2 of them are fluent. They're in Hawaiian language immersion schools, and brilliant kids, and bilingual. Their father, who wasn't brought up in the language, my number 2 son, is also becoming fluent in the language. He's pretty fluent. So while we lost it in my grandparents' generation, we're reclaiming that culture. And I think that that's part of the loss of culture, the loss of language, you have loss of your people.
Christen, I want to turn to you because you lost more than that. You lost your name, didn't you? You didn't understand your name. You didn't know what it was. Could you explain your film and exactly how that all turned into such a moving documentary?
Absolutely. Well, I guess I wouldn't say that I actually lost my name. It was always there. And
you didn't know the meaning, right?
Yeah, I mean, but the fact that it was there was something that I always felt connected to. Even after I left the islands, it was always, this thing that I felt would bring me back one day. And the film, E Haku Inoa, is basically about that journey. At the time that I started the film, I was actually living in New York City, and that was about 5 years ago. And I started this process, and I should say that I left the islands when I was 8 years old with my younger brothers, after my mother was diagnosed as a schizophrenic in the 80s. So that diagnosis really for us was the impetus for my family to be separated from our culture and from, at least me, I always felt a huge loss for not being able to grow up connected in the way that I would have had I been raised here. But in a sense, I think maybe it worked out all for the best, because I think I didn't have that access, and I had always wanted it so badly, that now it's really kind of coming to fruition. But
what is the film itself about? It's about coming back to your mother, right? Mm-hmm. And coming back
to learn the meaning of my name.
E Haku Inoa, to weave a name. Could you explain how that came about and how that took place?
Sure. I mean, really, it was just like that, that desire inside of me to learn that name that I always knew had some kind of greater meaning. My father raised me with the idea that, yeah, sure, you can look up, your name in the dictionary, but you're never going to know what it actually means until you talk to the person who haku the Inoa, who made the name. And thankfully he was knowledgeable enough to know that. So, but that process of me coming back to learn my name was really, I got to know my mother really for the first time in my life, and get, as I started to know her and listen to her, as you said, I began to realize, I'd grown up my entire life hearing that my mother was crazy. And when I actually spent time with her, I started to question the diagnosis of schizophrenia. I do know that when we were young, she had issues. There were problems in our family. She was violent at times. And there were, she had emotional disturbances. But as I began to talk to her about her experiences with working with psychologists and psychiatrists, they were really not only willing, but very, I think, eager to medicate her. And that was something that she did not want. And ultimately, she lost custody of us. And I think that was, and then that I feel very much a part of that legacy of displacement, of dislocation, because of that. Her not feeling comfortable around her psychologist, she never really felt that she needed to take pills. And that was actually her refusal to take those medications were part of the reason that she lost custody of us. And I grew up with this narrative where it was like, well, she didn't care about us, didn't choose to keep us. But after spending time with her, I think I realized that she never thought that anyone would have the power to take away her children because she was our mother. And how, if somebody who doesn't even understand kind of who she is from a cultural perspective, is suggesting that she takes medication, she didn't feel obligated to listen to them, but I don't think she ever really fully understood the consequences of what that would be.
Poka, did you want to respond to that?
In terms of at Hale Na'au Pono, the approach we take is, if we can imagine a triangle. Well, first let me say that Western medicine normally sees an individual who suffers from mental illness as something wrong with function in the brain. Either it's shooting out too much juices of one sort or another, or it's not enough. And as a result, you have depression, or you have excitability, you have imaginations, they call it schizophrenia, whatever they have. On top of that, it's important because the influence that you have among social factors, your friends, your neighbors, your family, and how you get this social support. So they developed this, what is called best practice, illness management and recovery, looking at an individual and treating that individual for what's happening in the brain as if that individual is a biological laboratory that you can change by a certain medication and to get that person's social support. When we received a program from the Department of Health to roll it out in the Waianae community, and we said, well, we're not willing to roll it out until we can acculturate or we can adjust that program to meet our particular needs. And after 2 years of study and going through the community, inviting people to come in and do an analysis, we say that they were missing two very essential points. One is spirituality and the failure to recognize the important role that spirituality has, not only in Native Hawaiians, but in all the other ethnicities. Usually when you ask a person, where did you first go to try to resolve this issue of somebody acting funny kind? Was it the doctor? Was it the psychiatrist? Of course not. It was the elders, or it was going to temple, or it was some other area looking at whether or not there's been this, some kind of spiritual touching or effect to that person. We don't admit it out in the public, but it goes on and on and on in our homes, irrespective of what ethnicity we come from. The third aspect of the triangle is circumstance, our conditions. It may be generational trauma that we have talked about earlier. It may be the economic situation, it may be homelessness, it may be all of these other factors. And so when you deal with an individual and you try to address that individual, you have to look at the recovery plan that will incorporate all of these possibilities. It doesn't mean that every Native Hawaiian has some kind of spiritual effect or some kind of cultural or other circumstance effect. But at least we need to open those windows, we need to explore with that person and have that person participate in the development of the recovery plan. And recovery is a term that we actually borrowed from alcohol and drug fields. Right. Yeah, it's no longer any maintenance or a sense that you're stuck in that position. Recovery is what you continually look for. So it's an upward position of moving a client.
Nalani, did I see you responding to something Poka said?
Well, there's a common misconception that psychiatrists all want to prescribe medicine. Actually, according to the American Board of Psychiatry and Neurology, there are several stages. One can have depression, something called a depressive episode, which does not require medication. One can have a brief psychotic episode, which does not require medication. And actually, if someone has a minor depressive episode, the recommended treatment is therapy without medication. If someone has a moderate depressive episode, the recommendation is therapy or medication. And actually, we don't have juices, we have neurohormones. The ones involved in depression are serotonin, norepinephrine, and dopamine. So I think there is a misconception, and actually when I go to the American Psychiatric Association conventions, there are people standing out with signs saying, stop medicating our people, stop medicating our people. And a lot of it, I think, is our fault. We don't educate the public well enough to know that step one in all of our programs is making an accurate diagnosis. If someone does not meet the threshold for schizophrenia or depression, we absolutely do not advocate medication. If someone meets just the minor threshold for, say, depression, we advocate simple therapy. If someone meets the moderate threshold, we advocate therapy or medication. And psychiatrists are not pill pushers, but for those who don't understand what our standards are and what our strict guidelines are for the American Board of Psychiatry and Neurology, there is a misconception, and it's not helped at all by the media. You know, you see skulking figures in the media, you know, pushing pills. So I think this is a good time to educate people about what our best practices really are, and we don't advocate medicine for everyone. And I can say, for my practice, I definitely do not advocate medication for everyone.
My question would be, what is the role of spirituality in the general healing? What is the
I'm
role
so glad you asked,
of
because
conditions in the general healing?
I came prepared to talk about the positive psychology movement that has come out of the University of Pennsylvania, started by a man named Martin Seligman, who originally was studying depression. He was the founder of Learned Helplessness, but he discovered that the DSM-5 was only focused on sickness. And he decided that psychiatrists and psychologists should focus on what is wellness. So he went across the world and found out cross-culturally, Chinese, Japanese, Indians, Hawaiians, everyone, what are the positive values that every culture considers as to be positive. So some of my colleagues, and I'm not allowed to say where I work, but some of my colleagues and I, one of them is the wonderful Kaliko Chang, brought together those values, and they are character, strengths, and virtues: wisdom, Ike Pono, courage, Vivo Ole, Lahui, humanity, some of the things you mentioned, Pono, justice, Ha'aha'a, humility, and Mana, spirituality. And these are universal values. Sure. So instead of focusing on illness, we focus on positive values, and those are the things we try to work with in our patients. So instead of focusing on what is making you sick, let's focus on spirituality and justice and temperance, and focus on those so that we can help you become well.
But I think oftentimes people are just treating the patient. They forget that there's a whole family and support system that has to be included in that therapy. And when we look back at our older ways of doing things for the kahuna practices, there was always, everything that Hawaiians did required pule. You pray. When you gather your medicines, you pray. When you apply those medicines, you pray. To the application, when we talk about what Poka was mentioning, is spirituality was part of the healing. So there's no application of medication or therapy without pule, because the power of that comes with the power that is given into and we heal the whole family, not just, and you want to heal the mind, the spirit, as well as the body.
Vicky, you just brought up the whole family. There's a whole lot of people involved. And how does Ann and Makakilo wants to know, how does the Hawaiian culture known to care for family members reconcile itself with the lack of care evident within a family who have mental health disorders? Does that strike anyone?
Again?
How does the Hawaiian culture, known for its care of family members, reconcile itself with the lack of care evident with family who have mental health disorders?
And that's a problem with the failure of the current medical approach or the current Department of Health approach, and the failure to accord more appropriate cultural approach, community approach. You know, these approaches have been in the community for many, many years. But, and that's why Hale Na'au Pono started up. We invited the state to leave the community because they were screwing up our people, because they had none of those inclusiveness, for example. You know, I earlier talked about Dai as opposed to Ola,
right.
with that individualism as opposed to Lokahi. The way we treat individuals are that individuals are to be protected and to be separated from everyone else. Just the issues of confidentiality and the inability to consult with other members who would be important members of the recovery team. So what I'm suggesting is that culture itself has to shift so that you can accord the whole community to become participants of the recovery of family members.
Christen, I'm sorry, you wanted to say something. Nalani, go ahead.
So what I want to suggest is a radical new approach, which is actually an old approach. So my father would say...
They usually all are old. They come around.
So my father would say, we have 3 piko, right? The anterior fontanelle, you've heard him say this.
Yes.
To the gods and our ancestors, the piko to our mother, and then the other piko
Yes,
to the
of course.
future generations, right? Our tradition is an oral tradition, and what our people used to do is to find someone to be our teacher, and then once we found that person, to stay by that person and to learn at their feet. Whether we're learning wisdom or courage or humility. And if you look at our people who really are learning their culture, that's exactly what they're doing. They're finding Auntie Aggie, and they're learning everything from her. They're finding Auntie Vicky, they're sitting at her feet, they're learning everything from her. They're finding Auntie Lenaala, and they're learning everything from her. And that's really the way, the spiritual way, to find health and growth. It's radical. It's not going to a doctor, but it's finding health and healing. It's not the same thing as going to the Department of Health. It's not going to a center.
Well, is there, Christen, I want to ask you this because I think it comes back to your mother and her diagnosis. What would your mother have been? You don't see you see your mother as culturally different and not really schizophrenic, right? As you come back to her, you said something at one point in something that I read that you felt like a big city kid coming back to a woman who did things at a much different tempo and in a different cultural sense than you had learned now in your 5 years in the city or whatever it was. I'm not asking that question very well. Do you understand what I'm trying to get at?
Not quite, but
I'm sorry. I mess up all the time. That's what I say.
but I guess I would say I don't also want to make my mother out to be, oh, she's this Hawaiian other. You know, she's a complicated individual, and one of the people in my film is Aukahi Austin. She talks about culturally minded care versus culturally appropriate care. And you know, my mother is not strictly a Hawaiian cultural practitioner. You know, she's very Catholic. She has multiple facets to her. So the idea of kind of like a blanket application of like Hawaiian cultural practice, I think is almost as could be potentially as harmful as not being culturally appropriate. You know, you don't want to shove this idea of like, oh, someone hears voices, it must be their ancestors. I mean, that's obviously something to be careful about as well.
Yes, absolutely.
But in that sense, you know, I think, you know, the idea of just listening and being together as a way of healing, just that, you know, caring for each other, me genuinely reaching out to my mother and wanting to understand who she was healing, not just for her, but also for myself, because I was dealing with those same effects of displacement, of being cut off, you know, and those things were affecting me in ways that I didn't quite understand until I was able to make that connection with my mother. And I mean, to talk to the question from the person, that idea of, well, how do we reconcile like a family not caring for someone who's mentally ill? I think there's a lot of things that go into that. You know, with my family, I think there were some people who kind of thought, oh, she got really deep into hula, and that was like awakened things that, you know, she shouldn't have dabbled in those things. And to me, that almost seems like our own fear of our own culture. And that's, you know, seems damaging from, you know, it's this idea of like mental colonialism, or, you know, being colonized in your own mind to be fearful of your own practices.
I hate to bring up a question that's this philosophical, but is mental illness defined by culture?
No, I have an answer for that.
Good, let's have it.
Okay, so according to the DSM-5, mental illness which is a Bible.
Right.
There are specific descriptions for each category of psychotic illness, mood disorder, anxiety disorder, substance disorder, et cetera, et cetera, et cetera. But there is a caveat for not better described by a person's culture. Is that clear?
Yeah.
So let's say someone has some kind of, well, I've already explained it. I don't want to overdo it.
Yeah, I would not accept the DSM, whether it's 4 or 5, and their definition of mental illness. When you're working in a community, the real question is, on this whole range of behavior that is acceptable, at what point does a person fall off and it becomes unacceptable?
Right.
A
So
danger
we define
to self,
it as impairment.
danger to others, whatever you define it as, because impairment can be many types of impairment. I'm hearing voices when I'm supposed to be on a TV show. That's an impairment, but I haven't fallen off.
It's not
So
impairment.
the definition that we would use, and as I say, I would reject if the DSM says this is the only definition you can have, is the community definition is at what point in time is a person needing the help, requesting the help, and falls off so that he becomes a danger to self or others. That's the way I would define mental health, well-being, mental illness.
So I have an answer for you.
Well, I didn't ask you a
Impairment-
question. That's my definition.
Impairment is defined as
But you're taking from a Western academic
Are you
training
gonna
of
let me
how to
answer the
define it.
question?
Well, you're defining. Let's be clear. What standards you are using to define a community such as Waianae or a community such as Hana Maui and the rest? You're taking University of Hawaii or wherever you came from and using that definition, and this is part of the rejection that we have had over a long period of time.
Nalani?
Am I allowed to answer? the
Yes, you are. I'm shutting him down right now. You went off the edge there. Nalani, go, please.
You're impaired.
First of all, that was flight of ideas and tangentiality. Second of all, impairment is defined as inability in several settings: work, family, occupational. So if somebody is unable to hold down a job, take care of his family, unable to take care of himself or others, poor hygiene, not able to take a bath, unable to get out of bed all day, unable to perform at his job, can't take care of his children anymore, his or her children anymore, can't feed them, whether it's Princeton, Harvard, UCLA, Hana, Waianae, wherever it is, that's impairment. And you don't have to accept the DSM-5 because the DSM-5 rules.
Well, it doesn't rule. It rules within the United States. It doesn't rule at the World Health Organization. They have many different kinds of standards.
It does rule at the World Health Organization.
Well, I beg to differ.
You can differ all you want.
I do.
I think Vicky wants into this. Do you want into this, Vicky?
I want into this because I think there are other applications for mental health that maybe don't fit because a lot of it, we're not addressing the foundation or the root of it. So if somebody can't take care of his family because they lost their job, and then they become depressed.
Right.
And then because of that depression, it's not really a mental health issue. It's an economic, social issue that has to be. So can we get to the root of the problem? What is the root of the problem? Sometimes the root of the problem is economics and social.
And we account for that.
And that is not mental health. That is inability to get back up on your feet. We have to help at that point. But you get so entrenched sometimes, you then the bills start pouring in and you get depressed because of that. But that's not mental health.
That's adjustment disorder with depressed mood.
Adjustment disorder with depressed mood. Okay, but I just want to say that it's like they're sinking.
Yes.
They're sinking, and somebody needs to help them up.
So the test is functionality within a society, within your community, within your family. If you can function well within your family, but you are somewhere else in terms of your imaginations, the real test is, do you need help for functionality? Not what the DSM-4 or a psychiatrist or someone else is going to tell you who you are or what you are.
But what about the Hawaii Business Magazine just came out with an issue in which they were looking at people by ethnicities and where they are and the kind of money they're making. And Japanese are at the top, Howleys are second, I can't remember where they went. But Hawaiians were down near the bottom, right? Now, if poverty is the problem, then don't we address poverty in Western ways?
Oh, we do, but
right.
not necessarily.
But then we're saying a guy's impaired if he's out of a job, or that kind of definition.
But your poverty is defined by Western money. Subsistence was our way of life: fishing, farming, getting back to the land. That is a wealth. If you look at economically, you look at Molokai, for example, they live off the land. But when you look in the statistics, they're at the bottom, but they're the wealthiest people because they don't have to buy. They're not buying the Spam. They're not feeding their kids the Spam. They're fishing. They get fresh fish from the ocean.
So now I think we're having a different discussion.
But I think it's part of it.
Did you want into this? Please come in, Christen, and help me. Get me out of this. I'm in a corner. I feel like the United States Congress and the president right now. Help me out.
Oh, well,
Stuck in gridlock.
They are absolutely related. I mean, these issues of poverty, they're absolutely contributing to depression in higher numbers in Native Hawaiians. And, that cycle of breaking out of that, how do you do that? Do you get rid of the depression first, or to get to the economic issue? I mean, is that even possible? Do you need to improve the economic conditions for Hawaiians somehow to be able to then work on depression? I don't know.
I want to ask a question that comes down to something that I've just noted in my lifetime in Hawaii, and that's that an enormous progress in the pride of Hawaiians. And there are moments when my feeling is, if I had to pick a group that has got the greatest sense of themselves and their pride, I would pick Hawaiians.
I'm so glad you brought that up.
Because of language. I was kidding with somebody the Hawaiian language now is the Hawaiians' revenge on we Howleys who can never get all the emphases right, and they're just there you go. Why can't you say it correctly?
It's a form of resistance.
The dance,
Yeah.
the navigation, so many things. Everybody wants to be able to do Hawaiian music now. All the kids want to do that. Hasn't that had a positive effect on Hawaiian mental health?
I'm so glad you brought that up, because since my father helped write the Native Hawaiian Health Act, and the pride of Native Hawaiians has gone up. And the reason he wrote that act was because as he was speaking about Native Hawaiians, he was afraid that the Native Hawaiians would become extinct by the year 2008. Less and less people were, as you all know, were identifying as Native Hawaiians. The graph and the census was going down, and he predicted that there would be no more Native Hawaiians by the new millennium. Since the Native Hawaiian Health Care Act, which passed Congress, more and more pride has come from the Native Hawaiian community, thanks to Punana Leo, thanks to the work you do, thanks to the work Poka does, thanks to Robert Uluvehi Nainoa Thompson, thanks to Robert Uluvehi Casimiro, who single-handedly revived a hula among men. And one of the wonderful things that groups like the Rotary Club does is give out the David Malo Award every year to recognize individuals who have really contributed to bringing about pride in the Native Hawaiian community. And you were there last year when we recognized Robert and Roland Casimiro. And I think to end this, or I don't know if we're ending yet.
We're not ending. No way.
On a positive note, I actually brought a list of people that we can be proud of in the Native Hawaiian community. Some are living and some are not. Mary Kavena Pukui, Reverend Abraham Akaka, Du Kahanamoku, George Mills, Kaupena Wong, Clarinda Lucas, Martha Hohu, Dorothy Kahananui, and Senator, in the living side, Senator Daniel Akaka, Danny Kalekini, Winona Rubin, William Kaina, Hanania Poliona, the Kamakas, Kekoni Blaisdell, Eddie Kamai, and this year we're honoring Buffalo Keaulana and Napi Napoleon. So I think we as Hawaiian people can focus more on those of us who are doing well and who are perpetuating the Hawaiian culture. And I admire so much Auntie Vicky and her foundation. And for me, there have been people like, personally, well, I don't want to say who's been personal for me, but there are so many people among us who are our heroes. And that was what our culture was about. Find someone, an auntie, an uncle, a school teacher, who inspires you. And that's what our culture is about, passing on the oral tradition. Find someone who inspires you. Your fourth grade teacher, the auntie down the block. That's what will keep our culture alive. Your Punana Leo teacher.
Christen, earlier, the good doctor over here took a shot at the media and said it's our fault that they don't understand. Well, we don't.
No, I didn't.
We don't. That's okay. I'm setting you up as a straw doctor here to get so I can. You're a filmmaker, and your film, E Haku Inoa to Weave a Name, this is your second film, right? Your second documentary?
It's my first feature documentary.
Your first feature documentary. Where do you think, how do you think the media can help or hasn't helped? My idea about mental illness is One Flew Over the Cuckoo's Nest, which has got a big nurse, tyrannizing people with medication. But is that, how can the media make an understanding of mental health better and more realistic?
I mean, I think there needs to be more forums like this one to discuss. I mean, and that was part of the reason that I made the film, to be able to show, and not to contradict what you were saying, but I mean, I think that Hawaiians are so prideful of being Hawaiian in some respects because they have to be. We have to be our own advocates. And but there is a study that actually I referenced in the film I thought was fairly interesting in terms of finding Native Hawaiians by Dr. Keawe Kaholukula, who studied depression in Native Hawaiians and found actually opposite of what he was hoping to find. He was hoping to find a correlation between a stronger Native Hawaiian identity and better instances of mental health or happier, healthier people, but actually found that it was the opposite. And he makes this connection between he posits that that's because the more closely you're identified with your Native Hawaiian heritage, you actually realize that there are these kind of it's a perceived racism that you encounter, and then that actually increases your level of stress and can contribute to depression. So that, as great as it is to be, I find strength in my Hawaiian identity. However, there's still the reality that, you know, even if it's this perceived pressure of living in a Western kind of philosophically or controlled area, that contributes to depression. And so there's still that reality of a perceived oppression.
Tom wants to know what can be done about the many crystal meth addicts. Many of them are Native Hawaiians in Hawaii. Any thoughts on that? Not a thought.
That's a tough question because I think that drugs are introduced and that's not something that is mental. It is, I mean, you know, it's a real drug habit. And how can we do that? I think we've got to get rid of crystal meth and the dealers. I think that's a social, I mean, that is, you know, we need enforcement. But you know, there's, yeah, we have to work on not having that so readily available to our people.
I would also add we have to find other opportunities for economic opportunities or many other opportunities, because if there's no employment, if there's nowhere else to go and the junk is so available, that's what they turn to. So it's more than just the availability of crystal meth. We have to address the education problems, we have to address the economic problems. All of these other problems need to be addressed.
Problems in the schools out there in Wai'anae.
Yeah.
How can you study in heat like that?
Yeah. So it's a whole thing. Crystal meth is just a symptom of what has occurred as a result of the kind of society we have today.
Self-medicating.
To a certain extent, self-medicating, and at times they don't need the medication, but it's for a joyride. And there's many other reasons for it. You know.
Bill from Pu'unui, I don't know what that is. Since studies of the where is that?
Liliha.
Oh, I never go to Liliha. That's not my.
Not Liliha Bakery.
That's not my hangout. That's not my hangout. I don't hang out there. I know.
I used to hang out there.
Been there twice in my life, I think. Since studies of, for example, the Holocaust Jews show PTSD can be inherited, what are their thoughts on PTSD being passed on to other generations?
I think that's a real problem.
Historians talk about cultural malaise of Hawaiians coming out of the 19th century with the decline in population and dispossession of land and so forth. Does that cultural malaise carry on over?
I think it's post-traumatic stress disorder on a racial basis, on a historical basis, and it follows the people for a period of time that we have not been willing to call it as such. So I think PTSD on a generational basis is something that is there. You know, that trauma has affected us. When I went crazy while I was in the military, realizing that what had happened, the illegality of the overthrow, and I'm volunteering to serve in the military during the Vietnam period. And that anger and you know, there's many other words I can use for it. And what we have gone through during the Hawaiian cultural and political revolution from the 70s on to the present time. You have, on a racial basis and more on a national basis, this great mourning as a result of the first stage of decolonization, recovery and rediscovery. Then we go back, we try to find out what are our names, what are the cultural practices. We go back and we find out that we had a nation that was taken away from us. And look at us now, the poorest in Hawaii, we're the most homeless, we are in these conditions. That is very traumatic for us. Sure. And so the anger that is in the community also is part of that PTSD that needs to be addressed.
Christen, you were nodding your head. What were you?
Yes.
Okay.
I agree.
You were going to say something too. I'm sorry, Vicky.
I was fascinated by, I think, some of the questions and the responses between both you know, Nalani and Poka and Christen, because I think that sometimes we walk a fine line for those of us that are in cultural practice for those that have been baptized in Christianity, and that can create some conflict within our own selves and families, and being judgmental of those of us that are cultural practitioners and or people that say, you know, well, you're pro-Hawaiian, that means I'm anti-American. Like, No, not necessarily. I'm just advocating for being Hawaiian. You know, it has nothing to do with me being un-American. I was born a Hawaiian. When I was born Hawaiian, and then I was baptized. I was still Hawaiian first. So I don't find the conflict within my cultural practice or with who I am. But I think that is a real issue for many Hawaiians.
Dan, I don't know how well you know my father. You said you've met him several times.
Yeah, he's been at this table several times over the year.
So my father's feeling that he's passed down to me is that he likes to make people very aware of the facts of the overthrow because he feels people should know about it. But if you have ever met him and spent time with him, he is a very gentle, loving, happy person.
Tremendously so. I agree.
He has
Tremendously
not used the overthrow to become an angry person. And when you talk about walking a fine line, I don't know how to express this, but my father is a person who lives very much in today. He has taught me to help people today as much as I can. And that's all I can say. He is a man who's lived 88 years, and I see no anger in him. He's taught people the facts of the overthrow and the annexation, and that man has no anger in him.
And he told me once about he didn't recognize these facts or confront them about the overthrow or what had happened to Hawaiians until he had come back from medical school.
That's right.
And was here in Hawaii, back in Hawaii, and suddenly things started coming.
Here's a man who was like the first Hawaiian professor of medicine at the University of Chicago. He had to use the honorable white bathroom at Tulane. But he has never expressed to me any anger about racism. He embraces white, Vietnamese, anybody of any color, and there's not an ounce of anger in my father. So it makes me a little sad when people who have taken up his, what do you call it? His badge,
Right.
and they're quite angry. Because my father is a person of absolute peace.
That's right. Everything I've ever seen of him. I want her to say her name. Can you say your name?
Well, it's a bit of a spoiler alert for the film.
Well, that's all right because I want to tell people when the film's going to go. Let's have the
Sure.
name.
Well, can we go with the short one, which
Okay.
is just He Puakoa? It's a part of it, part of a big, long name.
Okay, but E Haku Inoa Tuiva name will be shown here on PBS 2 weeks from tonight at 8 o'clock, our hour,
Yep.
and then afterwards there'll be an insight show in which there'll be a discussion of the film. Well, you'll be around for that?
Yes, correct.
Well, okay, and we will watch. We will definitely watch. Now, you won't say your whole name until okay, but it's
Sorry. Well, I know you're
it's-
just trying to kill like 2 minutes of airtime.
it's a heck. I never kill airtime. It's a heck of a name, let me tell you. Poka, what were you going to say?
The issue was on a racial basis or on an ethnic basis, or we can even make it on a national basis. What has been the transition and the changes within the race itself as oftentimes reflected by individuals. And what I'm suggesting is that we go through stages of decolonization, the first stage being recovery and rediscovery. And after we get into that stage, the second stage is the mourning stage, in which we are very bitter, we are very angry, we are all of this. But then we go into the third stage. There's some people who get stuck in the mourning phase. Okay? But there are others who can go into the dreaming phase and they talk about how do we structure the society, what kind of deep culture we have, how are we going to move into an independent nation or whatever the formulation will be. And then the execution and or the consensus building and then the action stage. So we are not here to examine Nalani Blaisdell or Poka Laenui or anyone else. But if we are talking about on a national-wide basis, this is where we have seen the movements within Hawaii, just with regards to the issue of decolonization. We have seen a lot of that mourning phase. And we have seen how media has participated in bringing about the conflict, raising or elevating those so-called leaders who are continually screaming and shouting and with all that bitterness, because media sells to that kind of conflict. But there's another part of the process, and that is the dreaming, the discussion that people are having in the communities, at the universities, in many other areas.
We're running out of time. So hard to do for a professor, but what would you do to improve mental health accessibility for Hawaiians?
I think we need to have better resources available and culturally based trainers or people that are immersed in culture, more Native Hawaiians that are in the field to help our own people.
Like Nalani.
Like Nalani.
Nalani, would you add anything to that?
Restate the question,
More,
please.
do we need more
people like
resources
you.
for accessibility? You know what? You're not going to have to answer that question. I'm not going to have to restate it because there's a guy over there going like that, which means we got to get out of here. Thanks a lot. It was a fascinating discussion. I really enjoyed it. I'm sure our viewers did too.
Thanks for having us, Dan.
Thank you. Next week on Insights, military service personnel returning from deployment to Iraq and Afghanistan often need support in returning to civilian life. Where can Hawaii's veterans turn for help with problems like post-traumatic stress disorder, depression, and alcoholism? On the next Insights, how can we help veterans and their families cope with mental health issues? That's next time on Insights on PBS Hawaii. I'm Dan Boylan. A hui hou.